My name is Marlena Besniak, and today I will be talking about childhood dysarthria. So, in this presentation, we will talk about kind of what childhood dysarthria is, what it looks like in the classroom, and what are some tips to allow those children to be successful in the classroom. So, first and foremost, what is childhood dysarthria? Dysarthria is a motor speech disorder involving weakness, paralysis, spasticity, or incoordination of speech-producing muscles. It results from damage to the nervous system and may affect approximately 1 in 1,000 children. This disorder causes difficulty controlling volume, pitch, and a student's quality of speech. These are all sorts of symptoms that are included, but a few of them are nasal and hoarse sounds, trouble articulating multisyllabic words, which are multisyllable words, and poor pronunciation. This is a YouTube video that I had found of a child with dysarthria. One can have this disorder at any age, but I found this one, and this child is in school, so I figured this would be the perfect one to show. Make sure my volume is up for you guys. So obviously throughout that video, as you could see and kind of gather, this child had slurred and slowed speech. Um, he also had kind of nasally and hoarser sounds, and there was also poor pronunciation throughout this video. So the second tip we'll be talking about is, what does this disorder look like in the classroom? So, a child who has dysarthria is more than able to be in the general classroom. They will be seeing a speech pathologist regularly, but this disorder does not impact their overall intelligibility, their cognitive development. Due to their speech difficulties, the student may be super hesitant to speak up in class. This is why further accommodations on the teacher's end need to be put into place. Step three is allowing children with this disorder to be successful in the classroom and kind of what that looks like. So, common instructional accommodations, obviously, any student with an IEP or one who needs accommodations are required by law to be followed. So, a few of those examples could be seating students away from auditory or visual distractors and monitoring sources of background noise. When lecturing and giving instructions on the teacher's end, we need to make sure that we speak slowly and clearly, using sequential words such as first, second, and finally, and using visual cues supports to aid comprehension for children who have dysarthria. Do not compel the student to speak in class unless speech is a required course competency appropriate for the particular student and within their precepts set forth by their IEP. Obviously, with the speech disorder, they're going to be very hesitant to speak up in class. One, because they know that they speak a little different, and two, they're not able to get their words out effectively. So that's going to cause embarrassment on their end, and they're not going to be able to get their needs quite across to the teacher. Assessment accommodations. Obviously, we need to refer to the student's IEP for specific assessment accommodations. As I had mentioned before, we are required by law to adhere to all prescribed accommodations. When assigning oral presentations, which will kind of be the trickiest part, but we need to allow students with speech or language impairments, such as dysarthria, the option to submit a different form or report, such as a written paper, or allow the student to give the presentation to a limited number of people. Again, this ties into the kind of embarrassment part, but also ties into the effectiveness of it. We're not going to make them give an oral presentation and then grade them on how that oral presentation was when they have a speech and language disorder. Many IEPs call for written exams to be delivered to them orally. So either you, as the general classroom teacher, a teacher's aide, or a special education professional or other educational professional is responsible for delivering a verbal exam to those with dysarthria. Differentiation is something that is huge for children with dysarthria. So here are a few ideas of how we can incorporate this in the classroom. Number one, consider using gestures and signals as opposed to verbal cues as means of communicating small items like attendance or readiness. Number two, incorporate more visual aids into your instruction. That is, don't solely rely upon lectures and videos for instructions. Students with dysarthria thrive on visual examples. They're really heavy visual learners. So allowing your children or your students to have examples like those is very, very important. Number three, allow all students some degree of choice when completing assessments and or classwork. Again, that kind of ties into the assessment side that we just kind of talked about, and also the accommodation slide. Number four, create a buddy system within your classroom in which students of all abilities are paired with a buddy. This just builds that trust and that relationship, no matter if they are in preschool or if they are a senior in high school with dysarthria. Having that person to build that trust with is super important. Someone that they can go to, someone that they can talk with homework about. I feel like this is the most important one out of all the differentiation ideas. And here are my sources. Thanks so much for listening.